So hopefully you were able to answer that question. 1 second. There we go. No. Oh, there we go. Yay. The gas exchange surface. So to prevent the moist walls of the alveolus from sticking together, a substance called surfactant is actually secreted by the cells in the alveolar wall. So the surfactant consists of phospholipids. This chemical reduces the surface tension of the water. So why do premature babies often have to be given artificial respiration? We talked about this a little bit in IGSI, about when babies are born and their lungs are actually developed. Exact same thing. And some reason my slides are weird. I legitimately had 2 slides. This was a pointless presentation. Well, I guess I'm going to switch to the other one. Okay, so give me a second, guys. See, at least this wasn't as bad as like the 112 slides I went through last week. Okay, so now we're going to switch to smoking and diseases. Keep in mind that next week we're going to have another, we're going to do another microscope lab because you guys need to get better at those. And we'll finish reviewing gas exchange. Oh, and I came up with a really cool idea. None of you guys are going to think it's cool. But I did come up with a really cool idea on how to review, which we kind of did before, but I wanted less PowerPoints this time. So you all are going to hate me. Tar is going to cause lung cancer, causes cancers, specifically due to the carcinogens. Nicotine is highly addictive. It can cause heart disease. Carbon monoxide reduces blood's ability to carry oxygen, and smoke particles are going to irritate the lungs and can damage the surface of the alveoli. So background vocab. CVD is cardiovascular disease. COPD is chronic obstructive pulmonary disease. Hemoglobin is HP. BP is blood pressure. So tobacco smoke. Mainstream smoke from filter or mouth end of the cigarette is 15%. Side stream smoke from burning tip is 85%. It has a higher concentration of toxic chemicals than passive smoke. So if we look at tobacco smoke and tar is a mixture of aromatic compounds that settles on the lining of the airways. It's associated with obstructive lung disease and lung cancers. When we talk about carbon monoxide, it's going to diffuse into the blood. It combines with hemoglobin to form the carboxyhemoglobin. This actually will result in the reduction of oxygen carrying capacity by blood by 5 to 10%. It also puts strain on the heart. This damages the lining of the arteries. It increases the risk of cardiovascular diseases. Why do I keep thinking there's more? Nicotine. Nicotine is actually considered as addictive as heroin because it's going to diffuse into the blood and it reaches the brain in like 2 to 3 seconds. So it's actually very quick. It does stimulate the nervous system to constrict the atrials, which we discussed are parts of the artery, and this is going to release adrenaline. Your heart rate and your blood pressure are going to increase. The blood supply to the extremities, so like your fingers and your toes, and technically other parts that dangle, are going to decrease. It also increases the stickiness of platelets. So if you recall what we learned about platelets with the cardiac system, all of that platelets are what resulted in clotting. It also is going to increase the risk of cardiovascular disease. So lung disease, and I think some part of it might be cut off, I'm sorry. Small particles deposited in the alveoli cause susceptibility to airborne pathogens and allergens. You have an immune response that can cause an asthma attack. White blood cells and mucus accumulate in the airway. Severe coughing fits damage the alveoli, and scar tissue replaces alveolar surface. This is including asthma, chronic bronchitis, and emphysema. COPD is the most common cause of illness and disease and death in most countries after heart disease and stroke. So when we talk about chronic bronchitis, tar is actually going to stimulate overproduction of mucus, and it's going to inhibit the actions of the ciliated epithelium. So if you have lots of mucus in your lining of your lungs, but you don't have that cilia, the epithelium that's brushing it off, and so you can cough it up, it starts lining it, and so then it's going to block the really small bronchioles, and it's going to at least kind of clog up the larger ones. Dirt and microorganisms actually can accumulate in the mucus, blocking more bronchioles. Smoker cough attempts to dislodge this mucus, and it's always that really dry kind of hacking sound. It's really gross, and often you can also start getting diseases from this. So the damaged epithelium is going to eventually be replaced by scar tissue, and the smooth muscle lining starts to thicken, which is also going to reduce airflow. That means that there's a great susceptibility to infections like pneumonia. Infection further inflames and narrows the airway. Sufferers have severe coughs and produce large quantities of phlegm, which is a mixture of mucus, bacteria, and white blood cells. You've probably coughed it up a couple of times when you're really sick. It's that really gross, chunky thing that comes out of your mouth. Emphysema. So emphysema is the inflammation of infected lungs that cause phagocytes to line the airways. To get there, they have to produce elastase, which is going to destroy elastin. Elastin is an elastic protein, which allows the alveoli to recoil during expiration. The lack of elastin is actually going to prevent the stretching and the recoiling of the alveoli, which is causing the bronchioles to collapse during exhalation and trap air in the alveoli, which can burst. This is going to reduce the surface area for gas exchange and reduces the lung capacity from approximately 4 dms cubed to less than 1.5 dms cubed. Air in the lungs is not refreshed and blood is not well oxygenated. This is actually leading to a very fast breathing rate. So emphysema can start looking like this, or as a disease progresses, lung blood vessels start resisting blood flow. This is also going to cause an increase in blood pressure because the pulmonary arteries are rising, which means that you have a leading to the enlargement of the right side of the lung. So this is not only just affecting your lungs, I meant right side of the heart, but it starts affecting your heart too. You start getting wheezing and breathlessness, which becomes progressively worse and can prevent you from doing physical activity. Sufferers often need a permanent oxygen supply through a face mask. Lung cancer, tea time. Okay, see, my voice is a little bit better. Maybe. Nope. Tar is going to contain several carcinogens. These are actually going to react with DNA. So if you recall, a couple months back, we talked about DNA and carcinogens and mutations that can occur with it. This is one of the ways. The DNA is actually that's going to be mutated is the one that's in the epithelial cells, which is going to cause malignant tumors. As the cancer develops, it actually is going to spread throughout the bronchial epithelium and is going to enter the lymphatics in the lung. Metastasis can occur, and that's usually the spreading of the cancer from one area to another, as we talked about months ago. It can take 20 to 30 years to develop. Most common symptoms actually involve coughing up blood. It can be detected by CT scans or X-rays or a bronchoscopy, where they shove a scope down your trachea and kind of check out your bronchus. I've never had it, but it does not sound appealing, given that stuff being shoved down your throat. Um, rarely detected before tumor. Rarely detected before tumor is 1 centimeter in diameter. Surgery is therefore usually necessary. Part or all the lung is then removed. So, lung cancer. Hey, look, a finger, random finger. If the tumor is metastasized, the secondary tumor will be unaffected by the lung surgery. Chemotherapy, radiotherapy, or more radical surgeries will therefore be necessary. My roommate got freaked out by the finger. So you can start losing parts of your body, especially with anything with nicotine, to lung cancer, and smoking. Smoking and lung disease general epidemiology. Cigarette smokes per day and approximately the early death rate per 100,000 men. If you smoke 0 a day, obviously you're going to have a low death rate, which is actually going to be 10. 1 to 14 a day, you're going to have 78. 15 to 24, 127. Over 25, 251. Man, my uncle should be dead. Up to 50% of smokers die due to smoking-related diseases. Smokers are 3 times more likely than non-smokers to die in middle age. That's probably why he's not dead. So COPD is rare in non-smokers. 90% of COPD deaths are related to smoking. 98% of emphysema sufferers are smokers. 20% of smokers develop emphysema, and twice the proportions of smokers die of pneumonia, influenza compared to non-smokers. Keep in mind, when we talk about smoking, it's not just the nicotine and tar. Anything that anytime you're inhaling smoke into your lungs, it could cause damage. There have been plenty of like information about different like jobs that could, because of what they're inhaling, can actually damage their lungs. And obviously any form of smoke, whether it's like vaping or marijuana, could have an impact as well. Smokers are 18 times more likely to develop lung cancer. This is mostly due to tar. 25% of smokers die of lung cancer. The likelihood of increasing by starting young, smoking more cigarettes, smoking for a longer time. So basically, if any of you are currently smoking cigarettes, stop. The risk starts to decrease as soon as smoking is stopped. Yeah, that's why my uncle's not dead. Experimental evidence. So tumors similar to those in smokers developed in animals that were exposed to cigarette smoke. There is a known carcinogen that is found in cigarette tar. Oh, they're puppies. I always forget that I put really sad images on these. Smoking and other cancers. So 1/3 of the cancer deaths are associated with smoking. It's a major cause of mouth, esophageal, so your esophagus, and laryngeal, your laryngitis cancer, bladder cancer, pancreatic cancer, intestinal cancer, renal cancer, and cervical cancer. Smoking and cardiovascular diseases. It's degenerative diseases of the heart and the circulatory system. You have coronary heart disease, stroke. It's the cause of 20% of deaths worldwide, the cause of 50% of deaths in the developed world. Multifactorial smoking is one of the several risk factors. And I will get back to this lovely one because I'm legitimately about to run out of time.